So I should probably start by giving you a warning that the next conversation does involve details around suicidality and suicide. So it's emerged that suicide-related deaths have increased by 54% in South Africa, and that's according to statistics released by Discovery compared to pre-COVID-19 levels, with the biggest increases from members who are under the age of just 40. So how important is it to try manage suicide and mental health risks in the insurance industry? Let's try and unpack this further with Brice Salence, who's Head of Actuarial and Chief Pricing Actuary with SCOR South Africa, and joins us via our video link this morning. And Brice, it's great to have you on the program. Thanks very much indeed for making time to speak to us. And I'm hoping before we get into the numbers, we could sort of just speak about the conditions we find ourselves in. You know, at the height of COVID-19, a lot of health experts were coming onto platforms like this, warning that what is likely to follow is a massive burden of mental health strain that is carried by people not only in South Africa, but certainly around the world. And it appears that's coming to fruition now.
Yes, definitely. Thanks. Good morning, Ayanda. It's great to chat to you. So certainly, from a life insurance perspective, we have seen a tremendous increase in mental health problems that is impacting the industry. And that's obviously related to multiple product lines. But when we talk about suicide specifically, that really is relating to the deaths that we see as a result of deaths by suicide on our life insurance products. And we started to see an increasing trend a couple of years ago, even before COVID. And I think COVID has really sort of heightened that increase. And we're certainly seeing a big increase in the prevalence of mental health problems in general, but specifically suicides. And a lot of the reasons there, as you've mentioned, you know, that a lot of mental health experts are linking that to financial stress specifically. Post-COVID, there's been a tremendous impact on people and society in terms of stress and the impact of the financial burden of deaths and that having an impact. Along with various other factors. So it definitely is a concerning trend, not only from a life insurance perspective, but I think from a societal perspective. And it is one of those ones that we really need to try and understand and tackle together to effectively manage the risk, but not only that, to try and help and assist as many people in terms of prevention as is possible.
Absolutely. Are you equally as taken aback that, you know, most of the contributions when it comes to suicide-related deaths come from people under the age of 40, or at least that age group?
Yes, certainly we see that the younger population do have a higher suicide rate. And interestingly, men also have a far higher rate of suicide compared to females. And there's a lot of reasons that could be behind that. And I think the most important thing for us to really look at is the stigma around mental health, specifically in terms of getting access to treatment, to reaching out. If you are feeling, you know, not yourself, a lot of the symptoms can present like feelings of hopelessness, being tired all the time. So it is really important to understand yourself and your symptoms and really not be afraid to reach out for treatment if you are feeling in those ways.
Yeah. You know, you speak about getting solutions not only for, I suppose, insurance companies, but also just for society's health in general. And when we think about that, you know, it takes us down so many different roads because, for one, this doesn't sound like a problem that any single industry is able to solve, you know, because even though the burden in some ways lies on insurers who cover such fatalities, it is actually an economic issue, a socio-economic matter, a cultural, religious sometimes issue as well. And so I suppose the obvious question that comes up is, you know, where do we kind of start in our approach here?
Yes, certainly. I think it's definitely not something that one industry should tackle alone. And we've certainly been, as an insurance industry, trying to look to partner with other organizations to try and tackle this issue and form, you know, industry groups where we can chat about this and try and understand what we can do to help our policyholders. I know SADAG, the South African Depression and Anxiety Group, does a lot of work in terms of suicide prevention. They run a great hotline that's available for everyone to phone in. And you chatted earlier about, that increase that we see, and we certainly see that as well through some of the statistics that SADAG has been producing. Even before COVID, they used to release, the number of calls that they were receiving on their call center. And they've seen almost more than a doubling of calls from 2019 to 2021 to the call center. So that really is quite a tremendous increase, but it is great to see that people are feeling comfortable and are able to reach out to that call center. So I think that's really important for us to carry on as well, supporting.
Yeah.
But I think more generally, we're also looking at, prevention initiatives, especially from an insurance perspective, in terms of telehealth services. And, often with insurance policies, you'll get underwritten at the beginning. You'll get your policy, and then there's limited engagement until there's eventually a claim. And some of the things we've been looking to understand is, how do we help policyholders, specifically when it comes to mental health, throughout that policy duration, and offer them services such as telehealth services. And SCOR has, for example, launched a partnership with iFeel, which is a digital solution that brings services to people at home through an app where they can, chat to a psychologist and are able to engage in the comfort of their own home. And this is a great opportunity for all companies and especially employers to really understand their workforce, who's taking a lot of sick leave, and try and supplement their offerings in terms of prevention initiatives that could go really a long way in helping us tackle this difficult problem.
Absolutely. What slightly complicates the situation, of course, is that many people are driven, not all, but many people are driven to mental health issues because of financial strain. And if you come to them and suggest that it is a psychologist who also needs financial backing, that is the answer to their solutions, they don't even give it a try. It almost seems like you're adding to their problems more than anything else. It brings us to having discussions around how accessible the help can be, especially for people who feel like, it's not within their reach given the nature of their problems.
Yes, certainly. I think that is been a big challenge for the industry in terms of mental health in general, just to try and access a psychologist, especially face-to-face, in terms of the cost, not only the cost, but the travel cost, having to wait often in waiting rooms. So a lot of these new type of technologies are really looking to try and reduce that cost by offering scale. So, for example, a lot of the programs could be launched to employer groups, which are large groups, which benefit from that economies of scale, where individuals don't necessarily have to pay for each visit on the app, but the employer could subsidize all of the employees, or there's a monthly cost. So I think we're very much in the earlier stages of these type of developments, but I really do see that as a positive step for the insurance industry in being able to try and access far more people in terms of help and assistance than was previously able to if you were trying to access the public or the private healthcare system directly.
Absolutely. And one wonders, as we round off our discussion, Brice, whether or not we've even come close to understanding the signs. Whenever somebody has died by suicide, their surviving relatives and friends always ask themselves questions about what could have been done to at least try pull that person just before they had made that decision. It's this kind of existential question that people are left with whenever there's a bereavement caused by someone who dies by suicide. Are we getting better at seeing what those signs are and, more importantly, intervening on time?
Yeah, I think it is a tremendous challenge. And I think for us, specifically from an insurance aspect, this is also something that we do struggle with through the application process in terms of how do we structure our questions to understand, mental health risk? Because it's often seen as very much, a silent disease where there aren't as many symptoms from sort of a comprehensive perspective. If you're taking other conditions, such as heart disease, we can get comprehensive medical tests, even other diseases. We could go for x-rays, MRIs. But with mental health, it's much more difficult to get a concrete diagnosis. And when we're looking at symptoms, that can certainly be very, very difficult. But definitely, I think getting support from your family members. We often see that a previous suicide attempt is a very high risk factor in terms of a final death by suicide. So that's certainly something for people, to be aware of in families, and if that is the situation, to try and seek help for those individuals. There's a number of other rating factors in terms of a family history of mental health problems can lead you to be more at risk. Financial stress, we mentioned before as well. So it is certainly something for us to continue breaking the stigmas around that. I think we chatted a little bit at the beginning around people not necessarily feeling as comfortable to reach out for help, as with other sort of diseases where there are different types of symptoms where people would go to your GP, if they've broken a bone. But with mental health, it is more difficult. And I think the more that we're able to speak about it, break through the stigma barrier and really work together across multiple industries, I really hope that we're able to tackle this and try and really play an important role in decreasing the suicides that we see specifically in South Africa.
Absolutely. No overstating the importance of this discussion. Brice Salence, thanks very much indeed for having it with us. Really appreciate your time on the AM Report today. Brice is the Head of Actuarial and Chief Pricing Actuary with SCOR South Africa. Once again, thanks very much indeed.